First, open the airway by using a head tilt chin lift by placing one hand on the forehead and the other on the chin. Push with the palm to move the head back while lifting the jaw to bring the chin forward. Second, clear the airway. Suctioning may be necessary to remove foreign material or secretions. Now that the airway is open and clear, consider a couple airway adjuncts to maintain patency. There are two main types, including the oropharyngeal airway for an unconscious patients and the nasopharyngeal airway for conscious patients. Selection of a proper sized oropharyngeal airway is done by assessing the flange at the lips of the patient, and the tip of the airway should be at the angle of the jaw. Insertion is achieved by pointing the tip toward the hard palate, then rotating 180 degrees until the tip reaches the posterior pharyngeal wall. Selection of the proper size nasopharyngeal airway is done by assessing the flange at the nostril, and the tip should reach the tragus of the ear. To insert, place the tip perpendicular with the maxillary bone, using gentle pressure in a spiral motion until the device is in place beyond the nasopharynx, providing a patent airway. After placement, listen to the chest to ensure that the patient is receiving adequate breath sounds. Now that we have our airway adjunct in place, we now move to bag mask ventilation. To properly use the bag mask, use the EC formation with your hands. To do so, form a C with the index finger and thumb of one hand on the top of the mask on the bridge of the nose. This securely applies the mask to the face. Now the three remaining fingers form an E and use these fingers to lift the jaw, opening the airway. Now maintaining this position, the provider squeezes the bag, taking 1 second to provide one ventilation. If a second provider is available to assist in bag mask ventilation, one provider will deliver ventilations with the bag while the other provider provides the EC formation with both hands to the mask. So you have completed your airway management skills training. Please feel free to review this as often as you would like, and we encourage you to practice your skills with a skilled healthcare provider. So please go out there and save lives.